Welcome to the Health Matters, Breaking Down Barriers. I am delighted that today we'll be able to present you some of the work that is being done at Oxford Health to make all our health services and information about health easy to access for people with a learning disability and therefore for all people. Our event is today being chaired by Kirsten, Prance, our Associate Clinical Director. And you can post your questions into the right-hand side panel, and we'll answer as many as we can in this event. This event is also going to be recorded, and the recording is going to be published on our Health Matters playlist on YouTube. And without further ado, I am going to pass on to Kirsten.
Hello. So my name is Kirsten Prance and I'm the Associate Clinical Director and Acting Service Director for Learning Disabilities within Oxford Health. And I'm a nurse by background. Today I'm also going to be joined by Ben McCay, who has been recently elected as one of our Trust Governors and is also supported by Rachel Miller, who is our Patient Experience Lead. And Ben is also an expert by experience within the Trust, who has also been hugely involved in the Leading Together group, where people with a learning disability have met with board members and had discussions around what differences, what changes we can make to allow people to be able to access and see the activity of our Trust in a more meaningful and easier to digest way. And I know that Ben would be very happy for anyone listening today to make contact with him as a new governor to take forward any issues that you may have or wish to be addressed through that forum. Ben unfortunately can't be with us today, so if there are any questions for him at the end though, we will pass them on so that Ben can then respond, and we'll post those answers after the event. So please do ask questions from Ben as well as from Simon and myself. I just wanted to kick off by saying a little bit about the learning disability services that we run. So in Oxford Health, we have 3 community learning disability teams that are place-based. One in the north of the county, covering Banbury and the west. We have another team in the city, covering the city and Bicester. And we have another learning disability team, which covers the Whitehorse and Vale region. So that's all the way from Abingdon across to Henley and up as far as Tame. Those teams are full multidisciplinary teams with a range of different professional groups from psychiatry, psychology, physio, SALT, occupational therapy and nursing. And they provide support to those with the most complex learning disability presentations, both around mental health and behaviour challenge, but also those with very complex physical health presentations. Those teams are supplemented by an intensive support service which deals with those with the most complex and challenging behaviours. So people whose understanding of the world is such that they require, very specialist support in order to be able to have meaningful and valuable lives. That team works across the whole county and links with the community learning disability teams. And whereas the community teams work with adult range only, our intensive support team also works with our LD CAM service to provide support to children and adults. And on top of that, we have a reasonable adjustment service. And that's a service where they work alongside our mental health colleagues to make sure that our pathways are adapted in line with the Green Light Toolkit so people can access mental health services. But they also have a function around supporting the reasonable adjustments required for people with autism. It's a very small and discreet team, but they have huge impact in making sure that our services are amended and adapted to support those when they're in their most at their most vulnerable and in their most difficult life situations. I think it's really important as well to note that as a specialist learning disability service, we work with a small percentage of those with a learning disability. As a trust, we can see the whole range of people with a learning disability, and there are lots of people accessing different areas of the trust who have never been known to a specialist LD service. So the conversation we're having today about how to adjust services, how to make things accessible, and to do the little things that make a huge difference on a patient's journey is really important. Some of you attending today will have worked with people with a learning disability and had no contact with the specialist LD service. Today, we hope that the information we share with you will give you a better understanding and insight into some of the small things we can do that make that access much more available. I think the other thing I'd like to say is that we've got in line a range of videos that are going to be coming up on our training portal for all LD staff. And those are an awareness around LD and the types of supports that we can do to make things more accessible. And we're doing a one similarly for people with autism, and we're doing the same around epilepsy support. So please look out, there'll be communication coming, and those will be available on our training and development hub for people to access. Without any further delay, I'm going to pass over now to Ben and Rachel so that you can watch the video that Ben, supported by Rachel, has prepared in order to give an experience of his care through services offered by Oxford Health.
Today I'll be talking to Ben McCay, one of our experts by experience. Ben, how would you describe yourself?
I would describe myself as having a physical disability and a learning disability.
Have you ever had any contact with our learning disability teams?
I have had no contact with the learning disability teams.
So, which services have helped you with your health?
I have used Oxford Health's physiotherapy department, and I have used Oxford Health's mental health services.
How well did that work for you, Ben?
It worked really well for me, actually. The physiotherapist came to my house to assess me, and it was decided that I needed an additional stairwell put into my house so I could go up and down stairs more easy. She gave me a list of exercises to do to help with my muscles in my legs, and she gave me a referral to go and use my local gym to help with the muscles in my legs. And I've also used the mental health services called Talking Spaces. They put me through to Principal Medical, and they counsellor got in contact with me, and I had 6 sessions over the phone. In the past, I've had to go to the GP surgery to have it, but I prefer to have it in the comfort of my own home, where it's just me and I can have a rant down the phone and the things are upsetting me.
That's great. Did they do anything to make it easier for you to access their services?
Not at all, not really, no. The only thing that made it a little bit easy was me doing it in my house or on the phone, that was all.
So have you got any top tips for how we can make it easier for people to access services?
I think the appointment should be put into Easy Read, and the exercises I got should be put into Easy Read as well. And if you are going to the GP surgery or to the hospital, more time should be allowed for your appointment, and they should think about how accessible it is for you to have the appointment there as well, and have it ideally downstairs if you struggle with them, like I do.
Right, and were you able to understand everything that the doctors and the physios and people said to you?
It was a bit complicated. I don't like it when they use jargon on acronyms. I'd like the acronyms told in full to me.
And finally, Ben, you've obviously got some great experience, and you're also able to speak for others with learning disabilities that might struggle to speak up for themselves. So have you had any chances to help services improve within Oxford Health?
Yes, I've been part of the Leading Together team. We're trying to put stuff into Easy Read to help people with learning disabilities and understanding more things about Oxford Health, especially if they go there for appointments. And even designed a learning disability Easy Read tool, and we've tried this out down at the Even Load Medium Secure unit.
That sounds great. Have you had any opportunities to be involved in interviewing or selecting staff?
Yes, I've been on the interviewing panel for the new medical director.
That sounds great. And is there anything else you'd like to share about the work you've done with Oxford Health?
Yes, there is. I've just been elected as patient governor on the Council of Governors at Oxford Health.
That's fantastic. And how did that come about, Ben?
I decided to, first of all, I became a member of Oxford Health, and I decided I'd put myself forward to be a governor of Oxford Health, because there's never been a person with learning disability as a governor of Oxford Health. So I thought I'd be leading the way.
That's fantastic. Thank you, Ben, for that. It sounds like you're making an incredible difference. So thank you for talking to me today.
That's great. Thank you for interviewing me.
Okay, so that's a video from Ben, and it's lovely to hear that he's become a governor, and he really is forging the way. And really interesting to hear what Ben has to say about how little things can make a huge difference to the quality of the journey for our patients. In relation to the next speaker, we have Simon Jones, who's our nurse consultant. Simon is also a fellow of NICE. He's a NICE fellow, and he's also been part of restraint reduction and lots of support around challenging behaviour, both within Oxford Health but also on a regional and national level. So I'm going to pass you over to Simon, our nurse consultant, who's going to talk to you about approaching people in a holistic way.
Thank you, Kirsten. Yeah, I thought there was a couple of things that I wanted to talk about, which I think, although they're directly relevant to people with a learning disability or people with autism, are actually relevant to the whole population. And the first thing was around we have an initiative in learning disabilities where people are entitled to an annual health check, and we get quite a good number of people presenting for these, but we're also conscious that we get about 70%. We would like to get 100%, and it's interesting when you look at the reasons why individuals might not attend for a health appointment. And when you start breaking it down, you realise that it's not just one factor, but actually if someone gets a letter for an appointment, a health appointment, are they able to read the letter? Are they able to understand what the letter is about? Are they able to recognise that the appointment that they're being asked to attend to is something relevant and of value? So that's one aspect. Then you've got the side of things of can the person physically get there? Do they need somebody to support them when they're there? And then when you get to the actual appointment, I mean, a lot of people are somewhat phobic about going into health settings. Certainly trying to navigate the healthcare systems can be quite complicated. When you go to for an appointment, you know, a lot of places nowadays have electronic systems. You then may be required to wait, and waiting times can be really quite stressful. I've just been waiting to come on and do this webinar. I think the waiting is often worse than the actual doing a session. And then obviously you've got your health appointment, and a bit like Ben was saying, that you may get overwhelmed with information which you can't necessarily all take in. You may hear parts of what have been said without seeing them in the context of anything else. So very much, as Rachel and Ben were talking about, having information in easy read format, something you can take away, and I think easy read is really helpful, because if you've ever tried to write an easy read document, it might be easy read, but it's not easy write, because you're trying to encapsulate a lot of information into one document, and therefore you've got to be very succinct and very punchy. So those are all the sort of obstacles that may get in the way of someone actually having an effective healthcare appointment. The other aspect I wanted to talk about, again, which is in terms of learning disability and autism, but I think is relevant to everybody, is when we're doing an assessment of an individual. And this is very much, as Kirsten was saying, trying to look at someone holistically. Obviously, somebody may present with a specific health need, But if you just look at the need in isolation, you're going to miss quite a bit. So we always try to look at both the person's physical health needs, but we also try to look at their emotional and psychological needs and how those sit alongside. And we now know that, you know, someone who's suffering from depression may feel physically unwell, vice versa. That there's, you know, the body is not separate units, they're all interconnected. We also try to look at somebody's sensory needs, and those can be really significant, particularly people with autism, but all the rest of us. You know, I just imagine if I was at a health appointment and the fire alarm was going off, which is, i.e. I'm getting excessive auditory overload, I'm going to find it awfully difficult to concentrate on what else is being said to me. And equally with other, if I'm sitting in an environment with flashing lights or smell of the drains, all these things, these are all sensory inputs which can overload your ability to cope with what's being said to you. We also try to look at people's relationship needs. Are they in a supportive and caring environment? And do they have people looking out for them? And do they have other people that they look out for? Those are all very important things for someone's well-being. Then we like to try and consider somebody's environmental needs. Do they live somewhere that they like? Have they got nice neighbours? Is the house warm and dry and comfortable? Do they have control over their own environment, or are other things defined for them? We all like to be as autonomous as possible, so those are really key considerations. And then the last two things we would want to look at is people generally like predictability. They need to be able to anticipate what's coming up, and when things come up that you're not expecting, I mean, all of us find that really threatening. So I think that's another area that we look at. We also try to look at someone's daily program. Does the person spend their time engaged in meaningful activity with people that they can get along with? We all, for those of us who go to work, I mean, it provides a big outlet for us, and sometimes some of the people we work with don't have that sort of high level of meaningful activity, and that can have a real impact on someone. And then lastly, we look at people's individuals' preferences and dislikes and try to respect and understand those in terms of when we're looking at their health needs. So just coming back to what we were talking about before, I think in terms of making health appointments accessible, as Kirsten mentioned, we look at reasonable adjustments, which is the jargon for just trying to make appointments accessible. They don't need to be complicated or sophisticated or expensive, but they are adjustments in how the patient pathway works for not just people with learning disability, but for everybody, and that can be enormously helpful. So those are just a couple of areas that I think are pertinent to us, but I think might be pertinent to everybody. So that's my bit done. I will hand you back to Kirsten.
Hi, Simon. Thank you, Simon. That was really, really welcomed and really helpful. I think the other thing that's really useful to point out is that there's a huge amount of information in accessible formats on the Trust internet. So not the intranet, on the internet, and that's based on our LD pages under useful information. And there is lots of information there around, you know, medications, side effects, COVID, physical health. There is, I mean, it's too wide to sort of list for you. But if you've got a patient with a learning disability or anybody who you think would benefit from having information in a much more accessible format, we really want people to use that site, both from internal and external, hence why it's on the internet and not on our intranet. So this is forward facing and out for GPs and other clinicians, and please spread the word because we want those tools to be able to be used. And in order to help with that a little bit further, we thought it'd be really helpful to show a video that's been produced about reasonable adjustments. So I thought if we show that now, we could then sort of say, and this is the kind of difference that you can all make. And as Simon says, they don't cost a lot. They are just about thinking a little bit differently and amending slightly our offer. So without further ado, I shall ask for the video to be played.
Sorry, Noosh, we don't have sound.
My system stopped working. I can't get sound back. Give me 2 seconds.
If you need me to say anything.
I'm just going to put you on screen, Kirsten. Sorry.
No problem. Hi, I'm really sorry. We seem to be having problems with our sound at the moment. So we've got someone at the background working away to try and get the pictures and the sound on our videos back up. While we're waiting for that, I just thought it might be useful to explain. Oh, I think we're back. Okay, we'll try again.
Reasonable adjustments in hospital are helpful changes to the way the hospital works with someone with a learning disability. Reasonable adjustments mean people with a learning disability can get the treatment and healthcare they need. Some people might think these adjustments are big, expensive and complicated things that are hard for doctors and nurses to do. But really, what we are asking for is only reasonable. Whenever Rachel goes into hospital for an operation, the doctors and nurses often use complicated medical jargon when talking to her about her treatment. She is not asking them to stay up all night learning a completely new language. That would not be reasonable. She's just asking the hospital doctors and nurses to use simple words when they are talking to her. This is a reasonable adjustment. Ben needs more time with his doctor to explain how he is feeling when he is unwell. Otherwise, he feels rushed. He's not asking to go on holiday to Disneyland with his doctor. That would not be reasonable. He's just asking for a bit more time, perhaps a double appointment. This is a reasonable adjustment. When Maria goes to hospital in an emergency, she gets very upset and stressed if the waiting room is noisy and full of people. She is not asking for a whole new hospital to be built just for her. That would not be reasonable. She is just asking that the staff find a quiet place where Maria can wait to see the doctor. This is a reasonable adjustment. Vernon doesn't like having to explain everything about his health conditions every time he sees a new doctor. He's not asking for every doctor in the hospital to know his medical notes off by heart. That would not be reasonable. He's just asking that every doctor or nurse who treats him reads the information in his hospital passport. This is a reasonable adjustment. These adjustments are reasonable, aren't they? Now think, what reasonable adjustments would help you? It is your right to ask for them.
Okay, so I'd just like to say that the video that we've just watched is part of a suite of videos provided by McCay, and we will post the link, and it's also on our useful information pages. But there's a range of small, really snappy videos that can be used for a range of different health settings, all around how we can adjust and make sure people can access healthcare effectively. I also wanted to sort of just reiterate the fact that within the learning disability services, we also have a range of clinicians who, if you're ever worried or want additional support, please make use of them, and we're really happy to support with information and advice on how we can adjust services. As I said, we see a small percentage of those with the most highly complex needs in our specialist services, but we've got very skilled clinicians who are always happy to help. And part of my role within the trust is to make sure that we have a platform to make sure we adjust for the access of all, whether that be through our mental health or our community pathways. The next video that we've got is one around nurse recruitment, and it's about LD nursing. And we've chosen it because it's really snappy, and it tells you a bit about the types of skills that people working in LD need to have, and the benefits of working in the learning disability field. Although it's a nursing video, and although myself and Simon are nurses, we feel that these attributes and these common areas are pertinent to all the people who work in our fields, from all the different allied health professionals and medical backgrounds. So if any of this that's in this video makes it you think that this would be a wonderful career to take into, then please come and have a chat with us, because we think it's a great place to work. We all love it. But hopefully this video will give you an idea of the type of attributes that we're looking for in staff working within this really exciting and dynamic field.
Did you know that there are over 1.5 million people with learning disabilities in the UK? What is a learning disability? It affects the way a person understands information and how they communicate. It affects people for their whole lives, and those with learning disabilities need a unique approach to care. They need people who think a little differently. Learning disability nurses have one of the most varied, exciting and life-changing careers in healthcare. You might think nursing means uniforms and often the same routine. But learning disability nursing is not like that. Every day is different. Learning disability nurses have to use a huge range of skills and talents. Sometimes they're investigators, trying to discover what's wrong and why. Other times they're activists, championing the rights of the people they support. They're discoverers, finding new, imaginative ways to deliver care. And creatives, who always look at things differently. Learning disability nurses work with people from all backgrounds, from all ages, in all surroundings, and across many different places. They're a force for social good, often working with the most marginalised and disadvantaged in society. People with learning disabilities sometimes have needs that are overlooked, but from simple, everyday things to setting up life-changing support for those in their care, learning disability nurses transform lives, and the UK needs a lot more of them. A lot more people willing to do an amazing job. A lot more people willing to take a different path. So do you value equality and human rights? Do you want to fight injustice? Can you look deeper than the surface? And do you want to do something different every day? Then look no further. Learning disability nursing. Dare to take a different path.
So now I'm going to pass on to Katerina, who's going to introduce the question and answer session.
Sorry, I was muted. Thank you, Karen. The first question is, in fact, from one of our newly elected governors, Karen Squick-Williams, and she's asking, I think this might be best addressed to Simon. Karen is asking, I am interested to understand why autism is so often categorized along with learning disabilities, when the two contexts are so completely different in manifestation and in management.
Yeah, that's a very good point. I suppose we work with people with a learning disability who may also have autism, but you're quite right that over 50% of people with autism do not have a learning disability, and their needs are quite different. So I suppose that there's a sort of there's overlap in terms of meeting the patient needs in terms of what we need to facilitate for individuals, but yeah, I think we're very clear that the two are separate areas. I think, Kirsten, do you want to come in there as well?
Yeah, and I think, yes, that'd be helpful. I think the other reality is that there has been a conflation between autism and learning disability following the Transforming Care agenda. So within the learning disability population, we have lots of people who have very ritualistic behaviours due to their cognitive and development delay, where they need routine and structure and have sensory overload. So you get the higher percentage of people with an autistic type presentation benefiting from some of the same care. But people without learning disabilities and autism do tend to have a very different profile. But when we had the Transforming Care agenda, there has been a linking of autism and learning disability. Now, some of the key skills that you need to successfully support someone with autism and some of the adjustments do sit well within the learning disability field. But I think we need to be really clear as well that people with autism without a learning disability have been very clear that they do not want to be portrayed as part of the same cohort. Their needs are different, their strategies and coping strategies are different. So we can use some of those skills and we can definitely generalise across in order to provide added value. But we have to look at the services for those with autism, but without learning disability separately from those with autism and learning disability. For no other reason, the best reason is that the people, our population, are saying they do not want them to be combined into one. But I think it's become a political matter.
Thank you, Karen.
Could I just add to that what Kirsten said as well? I think is also that we need to be aware that within the population of people with a learning disability, they're not a holistic population either, and that you will have a whole range of needs. And that's, I suppose, we're very keen to be treating people as individuals, and that somebody with a more profound learning disability will have very different needs from someone with a very mild learning disability. And we aim to try and tailor our support to reflect that.
Thank you, Simon. I think this next one might also be for you. This is from our audience, and it's about how can a patient ask for reasonable adjustments? I guess this relates to at what point in their interaction with the trust or a health service.
Well, I mean, the need for or the requirement for reasonable adjustments are enshrined in the Human Rights Act, so it is actually a legal requirement that they are made. I think that sometimes the difficulty becomes as to what is the interpretation of reasonable, but from my perspective, if it's the difference between somebody being able to have effective healthcare and not effective healthcare, then you're actually talking about something that is, you know, really serious, and therefore I think people need to be prepared to perhaps make a bit of a fight, because you know, what might seem trivial to one person is really important to somebody else. And as I say, if it means someone's going to be able to access effective healthcare, then it is absolutely essential. It's no good having good treatment if you can't access it.
Thank you, Simon. And I think we are still going to have you on screen, because this is about your specialism today. If looking at a person holistically touches many areas in their life, surely you would need to work with many agencies in order to improve or address them. How does this work in practice? Yes,
I think that is very true, and I mean that's, I suppose, a big part of our work is actually working with our other agencies, with our social care colleagues, and then that might mean linking through to employment, transport, accommodation. Yeah, but those factors are so significant in somebody's well-being and their quality of life, then they have to be done. And I think perhaps not enough of that is done. I remember working on a project with people who were presenting at A&E repeatedly, and the procedure in the past had tended to be to just try and effectively send them away, but they actually put together a team to try and investigate why were these people presenting, and it was very much around their accommodation was not not suitable, they were not in employment, their benefits were not being received, and it was until those things were tackled, the person was just going to keep coming, being a revolving door, coming back to A&E because that was the only outlet the person had got. So often you do have to invest time in looking at doing that holistic assessment, but it pays enormous dividends, because I think that so often we'll get a referral for a health condition, and the health condition, and particularly where it's a behavioural problem, that is the symptom, not the problem. And if we just deal with the symptom, then the problem doesn't get resolved. So that's why you need to take that extra bit of effort to look at someone holistically, but then hopefully it'll pay dividends in the long run because you're sorting out the root cause of the person's problems.
Thank you, Simon. I think maybe I'll pass the next one to Kirsten. And this is from Jessica, who is asking, what steps are you taking to let individuals and families know that reasonable adjustments are possible?
Okay, so yeah, I just want to also add on to a little bit that Simon said, because I think it adds into this question too. I mean, for me, people with a learning disability, it's a lifelong condition, so there won't be any surprises around people struggling to access or needing additional support, whether that be through family members or carers. So it's implicit really on all of us as health professionals to ask that question about how can we make it better, and also thinking around the case coordination around what is it that is going on, because if you've got someone who has been through our health services and has got complex health needs, then we need to make sure we're coordinating that care properly, because that will help us identify what all the blocks are to effective healthcare delivery. And it's more intensive in the short term, but in the longer term, it means that the health needs to be met more effectively, and you don't have people being held in health services ineffectually for a long length of time. In relation to how do we let families know what they can ask, yes, it's about linking with people like the Family Support Service. It's about sharing all of the easy read information. We've run in partnership with the CCG, OUH and primary care. We've run webinars and conferences virtually whilst we've been in this world with the health with our colleagues and families, so that they can know what is available, what the adjustments we can ask for, what are the tools we've got that can aid access. So we try our best to do those online events and work with families. And again, where we've got people open to our services, we have this case coordination approach, so that families are involved in every aspect of their loved one's care, and support providers. But it is something that we need to sort of spread the word for those who aren't open to specialist services, and say these are really helpful things that can be done that make it better, because advocating by family and carers is really important. And I think Simon also wanted to come in on that point.
Yeah, I was just going to add that we've been doing in the recent past a lot of work with GP practices and with acute care about what reasonable adjustments are, and helping them understand the need for them, and explaining the various types, and really trying to sort of raise awareness of the need to make those sort of changes, and to reiterate that reasonable adjustments don't just benefit people with a learning disability, they benefit the whole range of patients.
Thank you, Simon. I think this is all the questions that we have received today. So I am going to pass on to Kirsten for your closing remarks.
So thank you, Katerina. So my closing remarks is just to say thank you to everyone who's taken the time out of really busy either work or other schedules in order to join us today. We hope you found the information helpful. We'd really like you to think about becoming a member of our trust, because that gives you a voice. And as we know, I mean, we've heard very eloquently from Ben, who became a member, who's been involved in trust initiatives and is now a governor. So we'd love you to take that opportunity. But also, just to put a call out to say that if there's anyone on the call today who would like to know more about learning disabilities, or feels that there is something that they would like some additional help and support about, please do make contact with us. We really want to make sure that every single aspect of the service delivered by Oxford Health is of good quality and that you can access it no matter what your level of disability is, and that we'll work together to make sure that you can access the right care. And if you need support from us as specialist service in order to help do that, then please do make contact. So thank you all.